I'll ask you first, what do you think are the 3 words that the average healthcare provider is most afraid to say? Bingo. Okay. Well, in this audience, that was too easy, I guess. So the average medical student gets 1 to 3 hours of environmental health in his or her training. Mind you, I'll tell you from personal experience, I held retractors in multiple open heart bypass cases for 6 hours at a time going through medical school. So suffice it to say, it's a pittance. Now, that puts us in a very weird situation as healthcare providers when parents are bringing rightful concerns about the impact of chemical exposures on kids' lives, or adults are coming in with concerns about their own health. That puts the healthcare provider in a particularly awkward situation. But at the same time, parents are really seeking this information out with much more aplomb of late as awareness to these chemical exposures in our daily lives is increasing. And so therefore, we had the privilege and opportunity to really try to improve pediatrician knowledge, especially on behalf of the American Academy of Pediatrics, through a technical report and policy statement on food additive chemicals. And fortunately, I can build off other presentations, so I don't have to define anything. I can just leave it at the big broad category of food additive chemicals and take it from there. Now, this has already been touched on, but you might think the Food and Drug Administration in the U.S. has this under control. After all, you hear all these warnings about Salmonella, E. coli, and all sorts of other bacterial contamination. But I don't think this statistic has been brought up yet. Of the 4,000 food additives that were listed out and assessed for the available toxicity data. Now, this is a little old at this point. Less than 7% have data about toxicity to the reproductive system, and only 2 had data on toxicity to developing organ systems. So that's pretty obviously a call for more oversight by the Food and Drug Administration, ideally by Congress, to strengthen the rules for reviewing these chemicals in the first place. Now, when that report came out, I'll acknowledge there were a lot of responses from the chemical and food packaging companies saying, well, we've got this under control, and besides, the dose makes the poison after all. Well, I'll just add as a historical aside, you've already seen multiple pictures of Paracelsus or Theophrastus Bombastus von Hohenheim. That's my favorite way of saying it. He tinkered with opioids, by the way, and mercury as a little historical context. I always like to slip that in to provide some context. But suffice it to say, now we've got a lot more science that is undermining that evidence, and a goodly bit of it is by Laura and her colleagues in multiple reports. And it's not just the American Academy of Pediatrics that's saying it. It's the Endocrine Society. It's the International Federation of Gynecologists and Obstetricians. It's the World Health Organization and United Nations Environment Program. And to borrow Bruce Lanphier saying, little things do matter. We first figured this out with lead, methylmercury, pesticides, brominated flame retardants. The lowest level of exposures are the biggest bangs for the proverbial buck. So we need healthcare providers to adapt to this new reality. And what little we could provide in our statement was ample fodder for pushing knowledge from within, because we're not going to have medical providers go back to medical school, after all. There's an entire generation of doctors out and other healthcare providers out there who don't really understand this yet, need to know about it quickly. Now, nothing in the American Academy of Pediatrics statement, for example, contradicts the notion that diet and physical activity are leading contributors to obesity. But at the same time, we have ample evidence that there are at least 50 or so chemical obesogens out there. And 3 big categories of them are food packaging chemicals. Bisphenol A literally makes fat cells bigger, disrupts the function of a protein that protects the heart called adiponectin. And it's a synthetic estrogen, so literally can have sex-specific effects on body mass, especially during vulnerable windows such as puberty. The perfluoroalkyl substances, the forever chemicals, in one study where adults had actually successfully lost weight through healthy diet and physical activity. The higher the PFAS levels at the time, the more afterwards they gained their weight back. Phthalates, they literally change the way proteins are expressed, or genes are expressed in our bodies, that are key players in lipid and carbohydrate metabolism. So you imagine you're literally getting a healthy load, you do a good workout at the gym this morning, and you're thinking it's going to go right into muscle, right? Nope, it's not going there. And this is also supported not just by laboratory studies, but by human studies, as Linda and so many others have beautifully described. So one of the key points of this report was to point out that, at least as a pediatrician, I see plenty of patients at Bellevue Hospital, what little I still see patients now, who I routinely educate, eat a healthier diet, don't eat so much sugary snacks, exercise 30 minutes a day. But we have to take a broader mindset. There is this third and equally important factor, and it might be more readily modifiable than the hard work it takes to implement, let alone sustain, healthy diet and physical activity in our lives. So these ideas may seem impossible. These exposures may seem impossible to avoid in the first place, but we have data showing that you can immediately reduce your exposures to these synthetic chemicals in our daily lives. So Ruth Ann Rudell at Silent Spring and her colleagues did a study literally changing the diets of families and knocked down their bisphenol A and phthalate levels by between 50 and 65% in a couple of days. Eating a Mediterranean diet reduces your level of the perfluoroalkyl substances. So there are safe and simple steps that we can all take to limit exposures to the chemicals in food packaging that are of greatest concerns. I'm not saying we can get this down to zero, but it's not completely hopeless. We can already have talked about some of these. We can avoid microwaving plastics. We can avoid the plastics with the numbers 3, 6, and 7. We can avoid the use of nonstick pans. We can use cast iron or stainless steel instead. Those are just a few of the examples of the safe and simple steps that we recommended in our report, recognizing that not every family is going to be able to do that all the time. And there are financial and other built environment related, they're food deserts after all, circumstances that limit what folks can do. Now, consumers may feel powerless about implementing these things, but I keep going back to the BPA-free movement, getting BPA out of baby bottles and sippy cups. We didn't get it out of cans, and I'll have a different discussion about that towards the end of this session. But we need to use the stories that have succeeded here in this space and tell us that we really can have a huge impact. It was not science that got BPA out of baby bottles and sippy cups. It was consumer action and media attention to this issue. More recently, a study of just 5 packages, buffet-style food packages with perfluoroalkyl substances, prompted 2 major supermarket chains. Literally, you could see it on Facebook and Instagram. They pushed away their packages and got rid of them altogether and insisted on their upstream providers. They weren't making the packages themselves. They insisted that they change their ways and provide them packaging free of these materials in the first place. Therefore, we really need to push again and keep pushing on the importance of consumer movements and the power of the pocketbook, the wallet, or the purse. Now, in this time in the United States, at least, it may feel like we don't have the power to enact changes in major laws, at least for 2 years, hopefully not for 6 years, but I won't go further than that. But at the same time, I go back to TSCA reform more recently. That was facilitated, I'm not saying it was perfect, that was facilitated greatly by state action on a variety of chemical exposures that forced Toxic Substances Control Act. So it's the major federal law, not on food packaging, on chemicals in a variety of consumer products and other uses. Not personal care products or cosmetics, that's a different law altogether. But suffice it to say that the Chemistry Council literally ran to the negotiating table and made it happen. Together with a few, not all the NGOs I would have liked, who would have really made it a better law, but they actually accelerated the change in the law that was long overdue. That was a 40-year-old law, for example. So therefore, states really need to keep the pressure on. We've seen that in Washington, California, Maine, My home state of New York, less so, but we're number 4. We'll get there. They're getting there. So, and again, here's the good news. Many of the changes don't require federal legal changes. The FDA has a lot of power. They have said publicly they don't have a lot of power, yet they do. But at the same time, FDA does need the broader authority and must be forced to really be transparent, make sure the industry is transparent about what they're using in these products that are coming into contact with food in our daily lives. And so our report really lays that out, hopefully with an eye towards bringing stakeholders to the table, at least when the soil is more fertile for positive action on the federal level. And so I'll just close by saying I get this question a lot. How do you actually get hopeful in the morning or keep going when there's so many things going on and so much impacts on kids' lives? And I say I can see the examples where we've seen positive progress and victories. And so I come away very hopeful. And I know there are a lot of things we can do in the short, medium, and long term, both at the individual level and at the collective level to be the change we seek. So thanks for your time.